So today's conversation about the impact of Renaissance thinking on the history of medicine should be very interesting. As Dr. Cooper mentioned, this lecture series began in 2009 and was founded by Dr. Amjad Hussain. He and his family have been loyal supporters of the university and the College of Medicine and Life Sciences. And as Dr. Cooper mentioned, he's a University of Toledo trustee emeritus and emeritus professor of cardiothoracic surgery and emeritus professor of humanities. His family has also established a visiting lectureship in nursing in honor of his late wife, Dorothy. Our thanks again to Dr. Hussain for making this annual series possible. Thank you. We appreciate Dr. Cooper's leadership in the College of Medicine and Life Sciences, and both the university and the college are committed to offering a high-quality education to future physicians and other healthcare professionals, and we're thrilled that some of our students are here as well tonight. We are pleased to be able to welcome Dr. Syed Tasnim Raza, an associate professor of surgery at Columbia University Medical Center and medical director for cardiothoracic surgery at New York Presbyterian Hospital. Throughout his career, he's received numerous fellowships, holds 3 patents, and has been extensively published, most recently on the use of 3D printing in the medical field. And I'm sure we're all very eager to hear Dr. Raza's perspective on how the arts and humanities have influenced medicine in just a few minutes. But first, I'd like to introduce Dr. Amjad Hussain, who will come up and make some additional introductions. Again, thank you all for being here, and go Rockets.
Thank you, Dr. Gaber, Dr. Cooper. As mentioned, this lectureship was started in 2009, and this is the 11th year. I am most grateful for this time with this gesture of kindness on the part of the university. I also want to recognize Dr. Lloyd Jacobs, 17th president of the University of Toledo. This lectureship was established on his watch. Thank you, Lloyd. He's been very... You have been a good friend, and I enjoyed our friendship. I also want to recognize a gentleman who had nothing else to do in life. He traveled from Charleston, West Virginia, to come here this evening for a lecture. Dr. Zafar Khan, who's a cardiac surgeon in Charleston, West Virginia, and he's here with us. Thank you for coming. I also want to mention a few students. We have a History of Medicine club at the university, and it has been doing a fantastic job in terms of research, publishing papers, as well as giving presentations. And the president of this group is Niali Garo. Niali, would you get up? And also the other officers on the board. Please stand and be recognized. Thank you. Niali just published a paper in the JAMA Ethics journal, and her paper has been accepted in Kent, England. So what we are going to do is we're going to go and pass the hat to get some money for her, unless Dr. Gaber stands and say she has all the money in the world. But congratulations, I think it's a great accomplishment that your paper was accepted in an international conference. Thank you. Dr. Raza joins a number of exceptional scholars who have given this lecture over the past 10 years. His sister, Dr. Azra Raza, also She gave this lecture 2 years ago, and today she gave a grand rounds in the Department of Medicine. So it was great to have her and her brother here in Toledo. I also want to recognize Dr. Maurice Manning. He was also one of the lecturers about 5 or 6 years ago. Thank you, Maurice. So I am supposed to recognize Dr. Tasnim Raza. It's very hard to draw a circle around a multifaceted personality who has accomplished so much other than being a cardiac surgeon. But I will summarize. He is a 1970 graduate of King Edward's Medical College in Lahore, Pakistan. He was trained at Jewish Hospital in Cincinnati and the State University of New York at Buffalo. He served on various and numerous local and national boards at both the societal levels, medical societies, as well as hospital level. Since 2011, he has been an associate professor of cardiac surgery at Columbia University. And as Dr. Gaber mentioned, he holds 3 patents, and he has a special instrument and apparatus which he invented to facilitate the anastomosis of blood vessels. He is the author of 49 papers in international and national surgical literature, most of them in the peer-reviewed journals. And those of you who are familiar with this term, peer-reviewed, would know that it is a great accomplishment, and he has 27 abstracts to his credit with prestigious surgical organizations. But all that tells but just one facet of this gentleman. Dr. Raza, apart from being a superb surgeon, he is a researcher and teacher as well as a man of arts and letters. He is a painter of repute. His deep insight in Urdu language and English language literature, and above all, a deep appreciation of the value of history in medicine and humanities. Dr. Raza has accomplished much, but at the same time has been fairly grounded in medicine and arts, literature, and also has remained a very humble person. I just found one quote that I want to read this, and that is from William Wordsworth, the great English poet of Romantic age. And he said, "The best portion of a good man's life is little, nameless, unremembered acts of kindness and love." Please join me in welcoming Dr. Tasnim Raza.
Can you hear me? Does this thing work? Can you all hear me in the back? Okay, good. Dr. Sen, thank you very much. I almost didn't recognize who you were introducing, but I appreciate your kind words and a little exaggerated influence in it. Thank you for coming to this talk. I've been here before. I listened to at least once to the History of Medicine talk here, and then I've listened to my sister give talks. So it's my pleasure and honor. Dr. Gaber, Dr. Cooper, Dr. Hussain yourself, Dr. Zafullah Khan, thank you for coming. My friends in the audience, I feel honored. And when I look at the list of people who have given this talk before, I feel humbled. Because I'm not sure if I come up to the same standards, but I will do my best and hopefully do something worthwhile your time. So I'm going to give you just a broad outline of the sweep of history, how medicine came about from the antiquity, when there was basically just God's anger that made you ill, and your sacrifices and love for God made you better. It all changed over 2,500 years. It's a lot to cover, so I'll just be touching on things, but hopefully we can make a coherent story out of this. So we'll start with Hippocrates, who lived in the classical Greek age. Oh, this is a little bit different kind of pointer. He lived in the classical Greek age, born in 460 before the Common Era, and he is widely considered as the founder of rational medicine, as opposed to he freed medicine from the shackles of magic, superstition, and the supernatural. He's also revered equally for his ethical standards in the practice of medicine, and we all know about the Hippocratic oath that we take after medical school. So he was born in, you can see the red dot at the bottom right, a Turkish resort town of Bodrum. Right outside there's the island of Koch, where he was born. In those days, of course, this was all Greek areas. You can, for reference, you can see Athens over here and Istanbul up at the top right. So just to give you a perspective of where they were. We then talk about Claudius Galenus, who was anglicized name is Galen, who was born in the 129th year after Christ, or in the Common Era, and died somewhere between 200 to 216. It's controversial and not clear when he actually died. But he was a prominent Greek physician, surgeon, and philosopher in the Roman Empire. His theories dominated and influenced medical science for over 1,300 years. His description of human anatomy was based only on dissection of apes and other animals, and he had been appointed physician to the gladiators, surgeon to the gladiators, and he saw a lot of wounds, open wounds, that may have taught him something about heart and blood vessels. Galen was also born in what today is Turkey. In those days it was Greek areas in the province of Izmir, a place called Pergamum. You can see the red dot there, and you can see Bodrum at the bottom right again, Athens and Istanbul for reference. So I'll draw the timeline here from about 500 BCE to 300 of the Common Era, just to show where these people all fit. Socrates from 471 to 399 of the before the Common Era. Hippocrates about 10 years later. Plato 428 to 348 before the Common Era, and Aristotle 384. The Common Era started where we mark 0, and then Galen about 500 years after the classical Greek period, from 129 to about 207 year in the Common Era. So what were Galen's teachings that made such an impact that they lasted 1,300 years and went unchallenged? Galen actually talked about humoral pathology, which was originated in antiquity, and Hippocrates also believed in those theories, but Galen elaborated them into a very detailed theory. They were based on 4 elements: fire, earth, air, and water, and each had any one of 2 of 4 qualities: hot, cold, wet, or dry. Food and drinks and drugs were all composed of the 4 elements and 2 of the 4 qualities. Physicians had to know the quality of each. I still remember my mother and grandmother saying, "Oh, this food has hot effects and this food has cold effects. You can have it even in summer," and so on. Digestion resulted in turning this food into daughters of 4 elements. In Arabic, they used to call it Banat al-Arkan. 1 is blood, which is compared to air, hot and wet. 2 is phlegm compared to water, cold and wet. Yellow bile compared to fire, hot and dry. And black bile as earth, cold and dry. So then we came into the medieval period, or the Dark Ages in the West. But those Dark Ages happened to coincide with the Islamic Golden Age. And I'll discuss a few over the next few slides. What were the contributions into medicine of the Islamic Golden Age and what were their practices? They mostly practiced Galenic teachings. They translated the Greek works into Arabic and mostly believed in those, and that's why partly they went unchallenged. The Abbasid Dynasty ruled over the Muslim world from about 750 to 1258 of the Common Era. The Abbasid caliphs, especially Al-Mansur, Harun al-Rashid, and Al-Mamun, promoted an environment of learning and intellectual progress. The Greek works of philosophy, ethics, logic, astronomy, and medicine were translated into Arabic. This intense activity lasted almost 200 years from the early 9th to the 11th century. So here's the timeline just to put in perspective. About 300 CE on the left and about 1100 CE on the right. Prophet Muhammad of Islam brought Islam. He lived from 570 Common Era to about 632 of the Common Era, and the Islamic Golden Age lasted about 200 years, beginning in 758 of the Common Era. I want to digress for a minute to introduce a gentleman by the name of Alan Oldfather Whipple. Dr. Whipple, many of you would recognize from the operation for cancer of the head of the pancreas, the Whipple procedure. He was a Valentine Mott Professor and Chair of Surgery at Columbia University from 1921 to 1946. He had a very distinguished American family. One of his forefathers, Will Whipple, is a signatory to the Declaration of Independence. Calvin Coolidge and Franklin Roosevelt were distant cousins. Alan Whipple's parents were Presbyterian missionaries and lived in Iran. Actually, they were one of the first 150 families that moved to Ohio when the West was, when America extended into the West. So, and their parents. His parents then got married and left to go to Iran. He was born in Iran himself, Alan Whipple, and lived there until age 14. But then after he retired from Columbia, he went back there, did some research, and wrote a book called The Role of the Nestorians and Muslims in the History of Medicine. That's how I got interested to begin with in this subject about the history of medicine and what it took. Alan Whipple was the first to introduce me to it. This book was published 4 years after he died. He died in 1963. The book was published in 1967. I learned much about Alan Whipple by a surgeon from Toledo. Dr. John Howard was a surgeon at University of Toledo. He was interested in pancreatic surgery, became impressed by Alan Whipple, and he wrote this 2-volume big book, 1,200 pages, on the life and times of Alan Oldfather Whipple, the missionary and the surgeon. Very good book. So once again, the timeline, and I'll just mention some of there was hundreds of Muslim physicians and other physicians during the Islamic Golden Age who practiced and promoted medicine the way we know it. I'll only mention about 6 of them and what they contributed, just to keep it brief. First, Yohanna Moussaoui, popularly called Messieu. He was a Nestorian. Nestorian is an outshoot of Christianity that started in Syria, but the Christians ousted them because they thought they were becoming disbelievers. And they settled in Iran, so mostly, and they made a lot of contributions in medicine in Iran. His main contribution was that he performed dissections on the top right and described allergies for the first time. Muhammad al-Razi, or popularly called Razes in the West, was Persian, lived from 865 to 925. He is the first to differentiate smallpox from measles, described recurrent laryngeal nerve, mercurial ointment, hot and cold compresses, but most importantly wrote Al-Hawi, a 30-volume medical encyclopedia. Al-Zahrawi, or called in the West Abul Qasis, was actually in the Spanish part of the Islamic Empire in those days, lived from 963 to 1013. He is widely considered father of surgery. He described the first tracheostomy, lithotomy of a bladder stone. He developed cotton and use of cotton in catgut sutures. He described extrauterine pregnancy, cancer of the breast, and hemophilia. The most famous of all the Muslim physicians on that age is Ibn Sina or Avicenna, who described meningitis, anthrax, tuberculosis, urethral drug instillation, value of hygiene, dietetics, but most importantly wrote Qanun fil Tib, the canon of medicine, the absolute authority in medicine for 700 years. Sir William Osler, one of the great physicians, American physicians who practiced at made Johns Hopkins what it is today, described Avicenna as one of the most important physicians to have lived through the ages. So he was quite accomplished. We then meet another physician from the Spanish side of the empire, Ibn Zuhr or Ibn Zohar, who described pericarditis, mediastinitis, and paralysis of pharynx. Importantly enough, not the last one, but importantly enough, Ibn al-Nafis was a Syrian Arab from Damascus, lived in the 13th century. His contribution was that he recognized pulmonary circulation. Galen had been teaching that the blood is produced in the liver, pushed out into the veins, gets to the right side of the heart, but goes to the left ventricle through unseen pores in the interventricular septum. And he was the first to describe in 13th century that no, the blood actually goes through the lungs and comes back to the left side. You notice that during the Islamic Golden Age, it was not just Muslims or not just Arabs who were making progress and produced so much new information. It was all kinds of people, Nestorians, Persians, Spanish, Arabic, and so on, and even many of the Jews. Moses Maimonides, one of the most prominent Jewish physicians of that era, or one of any era, was also from that time, born in Cordoba, Spain. But then he moved to Egypt, where he mostly worked on Jewish law. Most of his books are about Jewish law. But then he became a physician to make a living and became so good that he was appointed the physician to Sultan Saladin, an important Egyptian Mamluk. Much of the medicines were basically herbs, and they had very elaborate description of various plants and herbs and so on in many of the books, describing in great details how they're cared for, how they're grown, what can they be used for. And they were, throughout the century, they were upgraded in the 12th century, the 15th century. Many of them still survive. There were elaborate instructions how to make medications in the pharmacies, and they had these tabulated books where they could find the symptoms, location, application, and dosage of various medications. So there was some science to these things, but not quite the way we know it today. One area where they excelled was in ophthalmology. They knew the anatomy of the eye quite well. Ibn al-Kahal actually even became known as the oculist because he wrote so extensively about eye over his lifetime. He developed an operation for cataract because when the light couldn't pass through this dense opaque lens, he could put a needle in and push the cataract into the vitreous cavity to fall down. and you could at least get the light to the retina, and you could see blurred vision after that. So what was the state of medicine in the beginning of 14th century? There was no proper concept of human anatomy. Galenic teachings persisted in spite of some innovations and contributions by the Islamic or Arabic physicians from that age. Heart was thought to be in continuity with the liver, which pumped blood one way through the arteries. There was no circulation of blood. There was no concept of disease affecting individual organs. The whole body was either ill or well, based on the theory of four humors. The Renaissance started in the 14th century in Italy, mostly in art, sculpture, and architecture. In medicine, it took another 200 years before the beginning of some change in the medical practice. The High Renaissance in Florence, started in Florence, revolved around three towering figures you all know well: Leonardo da Vinci, Michelangelo, and Raphael. Renaissance in medicine started about the 16th century, and I will just trace this through some characters who played important role or represented their times quite well. I should caution that there were hundreds and hundreds of thousands of other surgeons, scientists, physicians who made contributions, who made important contributions, and we tend to sometimes forget it's not one person, but one becomes representative of the age. And so I'll just go through those representatives for brevity and sake of time. The most important first character we meet is Andres Vesalius, who was born and raised in Brussels in Belgium. He went to medical school in Louvain, Paris, and then arrived in Padua, Italy, at the University of Padua, where he was appointed professor of anatomy and surgery at age 23. Remember, in those days, professorship was awarded on the potential you had, not the accomplishments you had. So he was appointed professor because he was his potential was seen as quite bright. He worked on dissection of human bodies, many bodies he dissected, and developed detailed illustrations. So he did two distinctly different things than those preceding him. One, that he did the dissection himself, and two, that he had an illustrator who could make those drawings. He published his book De Humani Corporis Fabrica in 1543 when he was 28 years of age. And this book actually was the beginning of the transformation of medicine that's laid the foundation of modern medicine. You can see the two, this illustrator, Stephen Van Kalkar, was so good. This is a portrait of Vesalius himself on the left side, with he dissecting an arm. The arm has been exaggerated for effect, but it's a beautiful illustration. On the right, I love this skeleton, which is deep in thought. I don't know what he's thinking about. We then meet Ambrose Perret, a French surgeon of the 16th century. He trained as a barber surgeon. In those days, that was all surgeons were, basically barbers, and did some surgeries. But he became so famous in Paris that in 1552 he was appointed surgeon to the emperor, known as a gentle surgeon for his emphasis on treating tissues with care. He introduced ligature for controlling large blood vessels rather than hot iron. He also changed the practice of pouring boiling oil on gunshot wounds. The surgeons, barbers were practicing in those days, but he produced an emulsion of eggs, rose water, and turpentine. Sounds better, although I don't know if it did any good. Perret has many aphorisms attributed to him. I've just put down two here for the students and young folks in the audience. One, always hold out hope to the patient, even if the symptoms point to a fatal issue. And two, he who becomes a surgeon for the sake of money will accomplish nothing. William Harvey, an English physician, he received his doctorate at the University of Padua, the leading medical school at the time. Once he returned to England, he was appointed physician to James I. He's the first to recognize systemic circulation of blood. His key work, Anatomical Exercise in the Motion of the Heart and Blood in Animals, was published in 1628. Pulmonary circulation, as I mentioned before, had already been recognized by Ibn al-Nafis in the 13th century and by a Spanish physician, Servetus, in the 16th century. Giovanni Battista Morgagni graduated from another founder of pathology, was anatomist and pathologist at the University of Padua. He graduated from Bologna, then moved to Padua, where he became chair of anatomy in 1715. He was an accurate anatomist. His major work, The Seats and Causes of Disease Investigated by Anatomy, was published in 1761, and we know him as the founder of pathology. Gross pathology, the organs, as they called it. So University of Padua really made great contributions. I have summarized here some of the important ones. Andres Vesalius, we already talked about him. Gabriel Falloppio, many of you will recognize, described the tubes leading from the ovary to the uterus. Bartolomeo Eustacio, the eustachian tubes from the throat to the middle ear and the valve in the vena cava. Gerolamo Fabrizio identified the valves of the veins in 1603, and William Harvey was his student, and I think it's the recognition of valves in the vein that led William Harvey to recognize that the blood actually runs towards the heart in the veins, not away from the heart, and he then surmised that it was circulating back to the heart. He also calculated that if the liver had to produce enough blood for each heartbeat, it would be tons and tons of blood it has to create every day, and there was no possibility of that being true. Giovanni Battista Morgagni, you already saw, the founder of pathology. Here's one of my famous heroes or characters that I adore. He's considered the father of surgery. The first surgeon scientist, John Hunter, lived in the 18th century, a British surgeon. He never really became a doctor. He never went to medical school. He learned anatomy and dissection as an assistant to his brother, who was a physician and obstetrician in London, who had, to make money, he had opened a private school of anatomy. And the students were coming and they were teaching at home on the dining table dissection of human bodies. But he became so good that he actually separated from his brother, opened his own school, and then became a surgeon in 1753 and practiced for 40 years in London. The Hunterian collection of dissections can still be viewed at the Royal College of Surgeons in London, and it's a beautiful thing to see. I, of course, have visited a few times. The 5th annual Amjad Hussain lecture in history of medicine was given by this journalist, historian from London, Wendy Moore, who wrote about John Hunter as the knife man. Beautiful book, a very good book that I've given out to graduating residents for many years now. Almost out of print now, actually. But that was the first time I came to Toledo to attend to this lecture. Two other things about John Hunter. This is the statue in the Royal College of Surgeons in London. John Hunter is considered father of modern surgery, and the highest award the Royal College of Surgeons gives out each year is called the Hunterian Lectureship. Professor Adib Rizvi is one of our good friends, my sister's teacher, mentor at her medical school, and a great friend who has done so much work. He's the only Pakistani surgeon we know that have actually received the Hunterian Lectureship. It's a great honor, and I wanted to show his picture only because he himself should be a topic of one of these talks, because he is just so amazing what he's done. He's been nominated for Nobel Prize now several times, and hopefully one day he will receive it. Oh, sorry, I went backwards. René Laennec is a French physician who invented the stethoscope. It was quite an accident that he was In those days, people used to just put their ears to the chest wall to hear heart sounds or chest sounds, and he saw this patient that was large-breasted and not very clean, and he just couldn't put his ears there, so he picked up a piece of paper, folded it, and put the piece of paper, and then he eventually got a piece of wood with a hollow wood that he used as a stethoscope that led to the invention. But he perfected the art of auscultation of the chest by correlating the sounds he heard during life, made detailed notes, and he performed autopsies on patients who died then and studied them and correlated the sounds he heard with the findings he had. He was the first to describe findings of clinical findings in pneumonia, bronchiectasis, pleurisy, pneumothorax, etc. Unfortunately, he died at the age of 45 of TB and probably had many of those sounds in his own chest at the time. Rudolf Virchow, a great German scientist, pathologist of the 19th century. He pioneered the modern concept of pathological processes, described the cell theory of disease. As Morgagni had described the organs to be disease, he actually described that it's a cellular process at the cellular level. He's also one of the founders of the science of anthropology, field of anthropology. He actually published more papers in anthropology than in medicine. But we know him as a medical doctor who described Venus, the Virchow's triad, everybody knows, and venous thrombosis and pulmonary embolism. I distract again myself a little bit to show two Netflix shows about the Charité Hospital in Berlin. The Charité Hospital in Berlin from 1880s is in the 6 episodes that show this Virchow and Robert Koch and other physicians. 3 of the 4 physicians from that era received Nobel Prize eventually, and the show is worth watching. It's so beautiful. And then Charité at War is the story of Sauerbruch, the great German surgeon who had to suffer through the Nazi era and how to deal with the Nazis at this hospital. It's a great hospital. By the way, my son is living in Berlin and just had a baby at Charité Hospital. So he speaks highly of it. So medicine was progressing quite well and making some strides. Where was surgery at this time? Well, I'll read you a description of an operation from 1842. Good afternoon, gentlemen. Today I shall be performing an amputation of the thigh in the usual manner. Robert Liston was a famous surgeon of the early 19th century in London. The operation is over. From the first cut to the final stitch, the whole procedure has taken only 30 seconds. 30 seconds of remarkable dexterity, flashing blades, rapid movements, and brilliant showmanship. But 30 seconds of such pain that few patients are ever able to put it adequately into words. The memory of those 30 seconds will haunt them for the rest of their lives, if they live. The problem was lack of anesthesia. Until then, there was no anesthesia. And second problem, why he said if they live, is because those who endured the pain of surgery and got through it developed infection, and half of the patients died of post-operative infection. So surgery was not in good shape at that time. This is an old operation theatre in London, opened in 1821. I've actually gone up to it. It's the operation theatre is on the top, and the rest of the building is used for bringing the patients in and instruments and cleaning and so on. But the hospital is 2 blocks away on this side because they didn't want the screaming patients to be heard in the hospital. So they had to build the operating rooms away from the main hospital buildings. To go up to the operating room, there's a spiral staircase which is so narrow and the steps are high, so they have hung a rope that you have to hold the rope and then step yourself up to the staircase. It's quite something. I don't know how they got the patients up there. So this is the operating room up on the top. You can see the operation table and the instrument table, but most importantly, the seating for the audience. They were always, that's why it was called a theater. It was a theater, patients to come. And here's an operation in progress. You can see the patient screaming, struggling in pain, and there's 6 people holding him down. He has been inebriated with alcohol, about 6 shots of whiskey before he even got to the table, and then the surgeon is trying to amputate his left thigh in 30 seconds. So discovery of anesthesia is a great milestone in the progress of surgery. The agents which would first be used for anesthesia were long known, notably mostly being used for recreation, was including nitrous oxide, or called the laughing gas, and ether frolics, ether which was used for parties having ether frolics. Crawford Long in Atlanta, Georgia was the first to use ether for surgical anesthesia on March 30, 1842, but he never published his results until much later. It was the real credit actually for discovery of anesthesia goes to William Morton, a Boston dentist. On October 16, 1846, Morton demonstrated at the Massachusetts General Hospital the use of ether for anesthesia. Chloroform first was used within a year after ether was used. Cocaine for local anesthesia was first recognized by Freud, the psychologist, and one of his students, who eventually became an ophthalmologist, used it for operating on the eye for local anesthesia. Father of American surgery, William Halsted, experimented with cocaine for local anesthesia, but unfortunately kept licking on it until he got addicted, and that's a great story. There's a book about William Halsted, The Genius at the Edge, by William Imber, a plastic surgeon in New York. Great book, a great read about how Halsted, in spite of his addiction, became the father of American surgery. So the second problem we encountered is the infections after surgery. Suppuration of surgical wound was so common that it was considered part of the natural healing process. Some surgeons even called it laudable pus, which made wounds heal. Many patients would go on to develop sepsis and die. The mortality rate after any operation was around 50%, mostly from infections. While bacteria had been observed under microscope in the 17th century, their association with human disease was not known. There were, of course, no surgical hats, masks, gowns, and gloves. Operations could be performed anywhere, mostly on the dining tables at homes, in the kitchen table. Halsted did his own mother-in-law's gallbladder operation on her dining table in Albany, near Albany, New York. They wore the same frock coat for months and years, covered with dried blood, vomitus, and other bodily excreta as a badge of honor. The dirtier the coat, the busier the surgeon you are. And they never changed it. There are 3 major characters who recognized this problem, determined the cause, and changed how surgery was practiced. And 2 others who made significant contributions. Let's meet them. We first meet Ignaz Semmelweis, a German-Hungarian obstetrician who graduated from medical school in Hungary in 1844 and was appointed assistant in obstetric clinic in Vienna. Vienna General Hospital at that time was the leading medical center in Europe. All the progress was taking place in Vienna. There were 2 wards, obstetrical wards in Vienna, one run by the doctors, one run by midwives. Once he became an assistant there, he noted that the incidence of puerperal fever and maternal death was much higher in the doctor's hospital compared to the midwife's ward, in the doctor's ward. He also observed that medical students and doctors came early in the morning and started working in autopsy rooms where they were doing autopsies with their bare hands, but when the delivery call came, they just rushed over from the autopsy room to the delivery room and used the same unwashed hands to do the vaginal exams and so on. He argued that they were transferring some material from the cadavers which was causing puerperal fever. Of course, at that time, he didn't know there were bacteria. So maternal mortality rate from childhood fever was almost 25 to 30% in those days in the doctor's ward. Many obstetricians had accepted this as unpreventable. Semmelweis was able to reduce the mortality rate to 1 to 3% simply by instituting the strict hand washing on entering the ward and by washing bed sheets between each use. We still can't get enough people to wash their hands in the hospital. There's a big struggle going on every day. And by isolating mothers who did develop puerperal fever. When the senior surgeons got so incensed by his behavior and by his insistence that they change their practices, that they didn't renew his contract. So after the year, he was ousted from Vienna Hospital, and he went back to Hungary, where he reproduced the results in Pécs in his own hospital, where he became chief obstetrician. So most old guard obstetricians, then he started writing nasty letters to the medical journals, saying that these surgeons in Vienna are killing patients by not listening to him, by being so obstinate, and and so on. So they got so unhappy that they lured him back to Vienna on the pretext that they will honor him, but he was arrested at the train station when he arrived, and he was thrown in asylum. During this scuffle, when he was being arrested and thrown into asylum, he physically fought them, got a scratch on his forearm that got infected, and he died of sepsis 2 weeks later. Quite the price to pay for challenging standing authority. Louis Pasteur was founder of medical microbiology, a French chemist and microbiologist. At the request of wine producers, Pasteur studied why some wines go sour and discovered that it is live germs that cause the spoilage, and he published his findings in 1858. He also showed that yeast, which causes the fermentation of wine, is live organisms. He originated the process of pasteurization. The French honored him so much that they named the most important French institute of research as the Louis Pasteur Institute. My sister is working with them on some research problem now, and they have done some amazing work in the last century or more. Joseph Lister, you will know him from Listerine, 1827 to 1912, a British surgeon and scientist. He is from a Quaker family, finished medical school in 1852, and then became assistant to James Syme, one of the great surgeons of his times. Then he became surgeon to Edinburgh Royal Infirmary and finally to Glasgow Royal Infirmary in 1861. That's where he did most of his work. He got frustrated with the high infection and death rates after surgery, and he postulated that the infections were being caused by pollen-like dust in the air. He proposed using carbolic acid for cleaning hands and wounds, and then developed an intricate process of dressing surgical wounds. He actually treated a series of open fractures when the bone is outside the skin, which were uniformly fatal. And if he dressed them carefully with carbolic acid dressing, it didn't touch them for 7 days and then changed once again. 7 out of 8 of his patients survived with this treatment. The mortality rate in his ward dropped from 45% to 15%. He developed a carbolic spray, a machine that would spray continuously carbolic acid in the operating room so that it would clean up the air in the operating room. The people were having irritated eyes and burning in tears, and then they had to wash their hands. And the way the gloves were discovered actually was because William Halsted, when he came back to Hopkins after training in Europe and started working, his wife, who was his chief nurse also, or became wife afterwards, her hands used to become red and irritated from carbolic acid. So he hired an engineer to figure out what to do with her hands, and he developed the first set of gloves. So for her gloves, we got the gloves. So in 1865, Lister read the work done by Louis Pasteur, published earlier. He knew instinctively that Pasteur's work was true and that germs were likely also the cause of surgical infections. He was now convinced that his own method using carbolic acid to prevent infections seemed to fit Pasteur's theory. Yet there was great opposition by the older surgeons, same to as Ignaz Semmelweis. In London, Lister was looked down upon. All the surgeons hated him. They didn't want to go visit him. But it was the Germans who picked up this early and promoted it much more, especially at the Charité Hospital. By late 19th century, the theory had been widely accepted and he was honored. The book ends in the story of surgical infection. First meet Antoine van Leeuwenhoek, who was a Dutch scientist who made his own microscopes. The microscopes are already available, but he made his own. And he was looking at a drop of water under the microscope and saw hundreds of thousands of little organisms swimming in the drop of water. And he named them animalcules. He didn't know what they were, but he named them animalcules. Of course, there was no association with disease with these animalcules. But most importantly, Robert Koch, in 1843 to 1910, a German founder of microbiology, was identified bacteria to specific diseases. He got the Nobel Prize for his work in 1905. He was one of those 4 physicians in the Netflix program Charité that worked in 1880s Charité Hospital. So with the discovery of anesthesia and principles of aseptic surgery, one could now take the time to do operations well and in the depths of various body cavities. By understanding physiology, one could now devise operations for improving functions and quality of life, not just extirpative surgery. Surgeons were now attempting operations unheard of before on stomach and intestines, large and small, on thyroid, on lungs, etc. Surgical specialization was starting to take root, such as neurosurgery, plastic surgery, urology, and others, both in America and Europe. There are 2 giants of surgery from the late 19th century, Theodor Billroth in Vienna. We still do Billroth procedure today. Many of the surgeons would recognize it. And William Halsted, who's considered father of American surgery at Johns Hopkins. So the timeline for this transformation period from the 1543s, you can see from 1200 Common Era to 2000. The Renaissance started somewhere in the beginning of 14th century. Vesalius, we met the great anatomist from Padua, Ambrose Perret, the French surgeon, Gabriel Fallopio, Bartolomeo Eustachio, Girolamo Fabrizio, William Harvey, Giovanni Morgagni, John Hunter, René Laennec, Rudolf Virchow, Louis Pasteur, Ignaz Semmelweis, Joseph Lister, William Halsted, and finally we get to Theodor Billroth, and finally we get to the first suture of the heart. I'll just summarize the progress to heart surgery in the next few slides, then I'll complete this. So heart surgery, with all the advances in surgery, heart was still considered beyond the reach of the surgeon. Heart had been considered the seat of the soul, the life-giving organ, and it was widely believed that any attempt to tamper with the heart would only result in catastrophe. The most famous quote in this regard is by Stephen Paget. Many of you I'm sure heard about it, who in the preface to his textbook of chest surgery published in 1896 warned the surgeons that any attempt to suture the heart would result in losing the respect of one's colleagues. Same year, 1896, Ludwig Renn was a leading surgeon in Frankfurt, and faced with a dying young man who was stabbed in the heart, Renn took him to surgery, opened the chest, and very carefully placed 2 sutures in the right ventricular stab wound to control the bleeding. The patient survived, thus marking the beginning of heart surgery, or at least broke the taboo that heart surgery had created for centuries. But heart surgery had to wait many years and many other advances before it could be safely performed. Discovery of X-ray by Wilhelm Röntgen, 1895. Discovery of A, B, and O blood groups by Karl Landsteiner in 1901. Techniques of vascular anastomosis by Alexis Carrel in 1905. Discovery of electrocardiogram by William Einthoven in Germany, 1908. Development of endotracheal intubation by Chevalier Jackson and Henry Janeway, 1913. Discovery of heparin by a medical student at Johns Hopkins, J. McLean, in 1916. Diagnostic catheterization of the heart by Cournand at Columbia, Frostman in Germany, and Richards at NYU over a period of 20 years, 2 decades actually. Development of heart-lung machine by John Gibbon in 1952. So without all those other discoveries, heart surgery would not be possible. Many heart surgeons, of course, struggled during these years to develop some way to do heart surgery while awaiting all the other developments. Ludwig Renn, we already met. Friedrich Trendelenburg did the first pulmonary embolectomy and then attempted many more during the next decade, although none of them succeeded. But his student, Martin Kirschner, did the first successful pulmonary embolectomy in 1924. It's interesting to note that while Trendelenburg started the operation, did many unsuccessful, he was actually present at the meeting at the German Surgical Society meeting in 1924 when Kirschner, his student, presented his successful case. So Trendelenburg heard about it and he died the same year in December. So before he died, he knew that his operation succeeded. Elliot Cutler in Boston and Henry Souttar in London, 1923 and 25 did the attempted first mitral commissurotomies. Robert Gross did the first ligation of patent ductus in 1938 at Boston Children's Hospital. Alfred Blaylock, Helen Taussig, and Vivian Thomas created the systemic pulmonary shunt for tetralogy of Fallot in 1944. There's much written about this particular operation. Cooley, in his book 100,000 Hearts, describes it in great detail because he was the intern in the room at that time and was assigned to do blood gases on the patient. It's a very, very interesting. There are 2 movies on this particular operation made, one by HBO and one by the NPR, or one of the public television stations, because of the interest that it created and really gave a push to heart surgery. Dwight Harkin accomplished something unfathomable now. He did 100 consecutive, so he was appointed surgeon to the US Army Hospital outside London in the Second World War, and he operated on 100 consecutive soldiers to remove foreign bodies from in and around the heart without mortality. That's 1944, no mortality, 100 straight cases in a field hospital. It's an incredible accomplishment. But he showed that surgery on the heart could be done and could be successful. Charles Bailey in Philadelphia and Dwight Harkin became great competitors. They both did mitral commissurotomy within 3 months of each other in 1948. They're still arguing today who was first. But the golden era of heart surgery was really the 5-year period between 1955 and 1960, when most centers, out of frustration and lack of progress, gave up operating on the heart because the results were just not up to par, and they couldn't continue to do it. Only 2 centers left making progress, both of them in Minnesota, 90 miles apart. University of Minnesota and Minneapolis, where Owen Wangenstein, the chair of surgery, appointed a young, rebellious, maverick surgeon, C. Walton Lillihei, to become in charge of all heart surgery development. He did some crazy things, like cross circulation, where the mother or the father of a young baby was attached through tubes to the baby to support her heart while he operated on the baby. But people criticize him that you have devised an operation that can have 200% mortality. But luckily, none of the 50 cases that he did with cross circulation, there was no loss of donor, at least in any of those. He developed the bubble oxygenator and many operations that we do today. He trained many surgeons during that period, 59 of whom became chiefs around the country. And that's really how heart surgery spread between 60 onwards. I remember I'll just say one personal story. In 1963, I was 16 years old, and my mother had taken me to visit a hospital. She was seeing somebody and left me in the waiting room, and I watched on a black and white little TV screen the first mitral valve operation. This is May 1963. That was done at an American hospital and was being shown at this American missionary hospital. That's the day I decided I was going to be a heart surgeon. And it's just fascinated me that that was just the beginning of heart surgery, actually, so 1960s. He was also instrumental in development of the cardiac pacemaker because he had an engineer, Earl Bakken, working with him in the garage. And he asked Earl Bakken that when I finish the operation, the heart sometimes just doesn't start. What to do? So Bakken then developed a pacemaker that you could attach to the heart and the heart would start beating. And that's led to the development of pacemaker. Mayo Clinic, John Kirkland actually obtained the blueprints of the heart-lung machine that had been developed in Philadelphia, but John Gibbon, after doing 7 operations, 5 of the patients had died, he gave up. He put it away in the basement and said, I'm done. He retired from surgery. John Kirkland got the blueprints, developed the machine in Mayo Clinic called the Mayo-Gibbon pump, and then heart surgery became possible there. He reported 8 cases of ASDs with only 1 death. So my own heritage in heart surgery is through C. Walton Lillihei, who trained George Schimmert. George Schimmert then came to Buffalo, founded heart surgery in Buffalo, became one of the pioneers there and trained me, and I'm grateful to both of them for what they did. I met Lillihei several times because of Schimmert, just one of the nicest person to know and meet. But I'm grateful to many, many surgeons, historians, journalists who have worked hard to dig out this history and collected it all together into books, and I just enjoy reading them and enjoy talking about it. So that's it. Thank you very much. Thank you for listening.
Thank you very much.
Thank you very much.
It's a matter of great pride and honor for me to be here. My name is Sakir Masroor. I'm the Chief of Cardiothoracic Surgery. And this evening is especially emotional for me because in our journey, Dr. Raza and I shared a common path along the way. Spent 5 years training in the same medical school, King Edward Medical College, established by the British in 1860, which went on to produce a lot of famous physicians of its own, and one of the famous one would be Dr. Ayub Umayya. Many of you may know he came to the United States, a famous neurosurgeon. He developed the Umayya reservoir, which is implanted even now to deliver chemotherapy in the brain. He was the chief medical advisor to the U.S. Highway and Transport Safety, and his work on mechanism of blunt brain injury resulted in the report called the Prevention of Injury in 1985 that led to the formation of the Center for Injury Prevention and Control at the CDC. And he also was, some of you may remember, Louis Woodward trial in Massachusetts. He was the key defense witness in the trial of the British au pair who was accused of having shaken a baby to death. And he was the key defense witness because he told that the mechanism of injury did not correlate with the injury of the baby. The jury awarded her second-degree murder, but because of Dr. Umayya's testimony, the judge overruled. But thank you very much. It's been a pleasure. I learned some new things. I always thought the quote was by Bill Roth, that whoever sutures the heart loses respect of the surgeons. And I always thought it was Dr. Bill Roth who said that. I learned something new. You spoke about Dr. Walt Lillihei, and it's very interesting. Dr. Walt Lillihei, as a person, when one of his young patients had suffered inoxic brain injury, he actually encouraged the patient's mother to sue him because he knew taking care of that kid would be a lot of money. And he told her, my insurance will pay you $150,000, $200,000. He told her to sue him so she could take care of that baby. Those are the physicians that we look up to. They're not just surgeons, human beings. Do you have any recollection of your own personal trip during your training? Because as we see, life as a resident and surgeon is not the same. You know, the Bell Commission and all those things. Do you have any recollection that you worked with that you'd like to share with us?
Not recollections about Lillihei, you mean?
About Lillihei or your own time?
So Lillihei, I don't have any recollections. He was retired by the time I became trained for heart surgery, and I met him only because they honored him on his 70th birthday in Minnesota, and there was a big birthday celebration, and I happened to go there. They considered the first 59 chiefs that he trained, and those trained the second generation. So I'm one of the second generation Lillihei trainee. Vince Scott actually wrote a paper on it. But he was just such a lively character. He was on the go. He would be working from 8 a.m. and until midnight, and then he would be partying for 2 or 3 hours, and he would get 2 or 3 hours of sleep and back to work again. And this is when he was developing heart surgery. There's a great book, The King of Hearts, about Lillihei's life. It's very interesting to read. There are 2 stories about him outside of surgery that would astonish many of you. One, that he got appointed a professor and chair at Cornell in 1972. But he only lasted about 3 years because he was so rebellious that traditional place couldn't handle him. He was just doing crazy operations right and left, and he was forced out from there. Secondly, he was arrested by the IRS for tax evasion, and it turned out he didn't know. He had no idea what he was doing. Actually, they found, when FBI checked his office, they found dozens and dozens of checks that patients had given me uncashed lying in his drawers. But they sued him in court, and trial was held. He was eventually let go for his contributions, but in those days he developed a bad name because he was just so forgetful about these things. He was so into heart surgery. My chief used to say, Shimmert used to say, Raza, he was another character from a different world. And he had developed lymphoma and had radical neck dissection when he was a resident, still under Wangenstein. Wangenstein supported him through his own hospital. The night before they were going to do the first cross-circulation operation, the whole hospital board of trustees chairman called and said, this needs to be stopped. This is going to cause grief, and this is not the right thing to do. And Wangenstein took a stand and got permission from the patients and said, no, I'm going to support my young surgeon.
Actually, Wangenstein did his parotidectomy himself.
Yeah.
Yeah, he did the radical parotidectomy. And the other thing is, you're talking about hospitals stopping the surgery. It's a well-known fact. Charles Bailey, who did the first successful mitral commissiotomy, his first 4 patients had died. And his chairman had told him, you cannot do this operation if you don't succeed this time. So he booked 2 cases the same day at 2 different hospitals, one in the morning, one in the afternoon. The first patient died, and he rushed in his car to the second hospital. There was nobody to tweet in those days or call or cell phones. The other hospital didn't know that the first patient had died, and the chairman had told him not to operate. So he did the second operation that day, and that patient was the first one who lived. And that's how Charles Bailey became the...
I think he wants to wind up.
It's very interesting.
I think they want to wind up too.
Yeah. So We are very thankful to you for coming for this general beautiful talk and glimpse, and thank you, Dr. Hussain, for giving us the opportunity through this lectureship to not just talk about history of medicine, but where we are, and it gets an inspiration to move forward. We have a little plaque here to commemorate your visit, Dr. Raza. So here's the plaque.
Thank you very
commemorate your trip to University of Toledo.
Thank you very much.
Thank you very much. Thank you very much. Thank you very much, ladies and gentlemen. This ends the event for tonight. We'll look forward to seeing you again next year.
Thank you.